Hey guys, it's Alex from Dental Growth, and I got a golden nugget video for you guys. This is how to get results for your dental marketing campaign, the lead management side of things. So, given that we're able to get an ad that's getting a good amount of inquiries at a good cost per result, a lot of the effort comes in on the back end when we're managing the leads and we're booking them into the office and they're in the office, etc. Okay, so this is a really crucial step, and I have a checklist, literally a checklist. These are some check boxes. Like the more of these we can check off at each step, the better. And so, yeah, if you guys are an agency looking to implement these systems, there's a lot more details that goes into all this stuff. Feel free to book a call in the link below, or if you're a practice looking to implement a really highly effective dental marketing campaign for your practice and get consistent new patient appointments week after week, month after month, feel free to book a call in the link below. That being said, let's get into the video. So when a lead comes in, we get a lead, we get an inquiry. What are best practices for the contact rate? The initial, one problem you may encounter is, well, we're not able to get in touch with a lot of these leads. Like they're not picking up the phone, right? So here's how we solve that, okay? A bulldog call initially within the first 1 to 3 minutes or the first 1 to 5 minutes. So what is a bulldog call? A bulldog call is actually a back-to-back call. So if we don't get in touch with them on the first go, say we give them a ring, they don't answer, what we can do is hang up the phone and immediately call them again. Okay, now I know you might be initially thinking, okay, that sounds a bit much, a bit spammy maybe. Fair enough. If you guys aren't necessarily comfortable with that, okay, just give one call, okay? But ideally, for the best contact rate, this bulldog call will increase that rate a little bit. So we will get in touch with more people, okay? But if you don't want to do it, no problem. A call attempt within the first 1 to 3 minutes, we call that speed to lead. And this can also be done with automations in some of our systems that we've gone over in previous videos on the channel. Feel free, again, to reach out if you have any questions about that. But another checkbox here is 2 bulldog call attempts on the first day. So at least two follow-up attempts on the first day. So say they come in the morning at 10 a.m. We've given them an initial speed to lead call at 10 a.m. But we should also follow up with them, say, that afternoon, right? So maybe towards the end of the day at 4 or whatever, give them another call, okay? I would say 2 to 3 call attempts in the first day. This is the principle of striking while the iron's hot. A lot of times you'll find that there's a better contact rate, a better interest rate in the, coming in for an appointment when it's closer to when they actually submitted that initial inquiry. Another checkbox item is 2 bulldog call attempts on the second day and even the third day if you want. So again, we want to maximize that initial portion closer to when they submitted their inquiry, because that's when the inquiry is more fresh in their mind, okay? So we're following up, kind of front loading that follow-up a little bit. And once we made about 6 follow-up attempts, that's when we're getting to the point where, okay, we've given this a healthy shot, and now maybe you can reduce that cadence and that frequency to once every couple of days or once a week or less, okay? But we really want to maximize follow-up to make sure we're getting the most out of each and every single lead, okay? So that's just the principle of follow up a lot, okay? Now, we've followed up a lot. We've, front-loaded our efforts in the beginning, close to the lead call. We've done speed to lead, all that stuff. As far as leaving messages and texts, you can do those, but honestly, just simply making the call attempt is the most important thing, okay? With that being said, once we are able to get on the phone and get that contact rate up when we're getting on the phone with these leads, and we're going through the lead call, making sure that it's a good fit for the office, the insurance and finances checks out and everything like that they're close by, and we're starting to schedule them in. As far as the show rate, okay, what we can do here is, because again, real quick, one problem you may encounter is, Alex, these leads aren't actually showing up for their appointment, okay? So this is how we overcome that obstacle. We're scheduling within 1 to 3 days, okay? Because if we schedule for 2 or 3 weeks out, like we kind of normally do with other patients that actually show up to their appointment, these folks, there's a greater chance that it's not as relevant 2 or 3 weeks out. I know they might even suggest it. They might even say, hey, no problem. How's, the end of the month, because maybe in their head they're thinking, they want to find a time when they may be more free in the future. But the reality is we never get more free. It's just time just continues to go on and we're always busy, right? So I think it's kind of, I don't have a ton of data on this, but my hypothesis is that they simply want to kind of put the appointment in a time where they think they'll be more free, less stuff will be going on because it's, in the future, farther out, right? But again, like I just said, that's a fallacy. So if anything, it's kind of showing that the booking is a bit weaker, okay? But if they are willing and able to come in within that week or within the first 1 to 3 days of the call, like this is actually an urgent concern. It just shows a bit of motivation and a bit of urgency, right? So we want to schedule them within 1 to 3 days, okay? Higher show rate, end of story, all right? The second thing, and probably the most important part for the show rate, is that we are getting like a financial commitment, okay? So if we can get them to put a credit card on file with the office or some type of deposit, that's simply going to have the highest show rate, point blank period, okay? And we can do this with Stripe. If the office can put this into their PMS, that's ideal as well. And a card on file is probably easier to get than a deposit towards treatment. And as far as the deposit, you could say something like it's our no-show it's a $25 no-show deposit. It would go towards any of your treatment started. Okay, so there's no confusion of hey, am I getting this back, or what if I want to cancel or reschedule? I didn't no-show, so can I get my money back or whatever? It's like, no, this is going towards your treatment. If you don't show up, don't start, you said you were interested in getting this new patient evaluation, then like if you don't do any of that, then that goes toward your treatment. So, whatever. So that's a couple ways you can do the financial commitment there. The card on file is probably the easiest though. And of course it's pretty important to be pretty tactful with how you go about doing this. We have some scripts and things like that we use. But yeah, the card on file is definitely a great way to increase that show rate. Okay. And then some other ones, some of these may be like, of course, Alex, but they're important, okay? And this one is that we have a friendly, genuine connection felt. There's that aspect of rapport, right? A lot of these patients, they're submitting inquiries and they're kind of like shopping around a little bit to see where they actually want to go, because in this day and age we do have options, okay? They're not just saying, okay, I remembered I needed dental care, I'm going to go to the first place that I can find. A lot of times they're kind of looking around, okay? And that's fine. That's being a consumer, that's being a shopper, whatever. So if we can do a couple extra things to make sure that we do have a great lead call, there's a better chance that they're actually going to show and start with us, okay? Friendly, genuine connection, rapport, etc. They seem like they're enjoying the conversation, okay? And now, a lot of times with that being said about them shopping around, them looking around, them not necessarily committing right away to the first ad that they click on, right? A lot of times they'll come in with questions, with price questions, with, just kind of like qualifying the office a little bit. So do you guys do this? How much is this? They're kind of interviewing you guys a little bit, okay? So with that, we want to kind of regain control of that conversation a little bit by turning some of their questions into questions about what their needs are and their context and their background, etc., and to make sure that we can actually help them, that they actually do need an implant, that when's the last time they've actually been in for a cleaning, etc., right? So it's not necessarily, so a lot of times with price questions, they'll say, how much is this? And we kind of are tempted to either give the price right about, okay, it's this amount. Oh, cool, thanks. All right, talk to you later. Bye. Hang up the phone, okay? Or they ask the price question, we say, yeah, you're going to have to come in for an appointment for that. And now it's just like we're gatekeeping a little bit, and they're like, okay, cool. Like they just feel like there's nothing there. The best way to do this is kind of an intermediate, which is like, oh, yeah, awesome. I'd be happy to help with that. And then turn that back into questions about their situation, making sure it's a good fit, okay? So that's that one. And then also that we've shared directions, address, parking, that the actual transportation logistics have kind of been shared, and they're kind of painting a picture in their head. Okay, yeah, it's only 15 minutes away. There's parking there. Cool. Everything checks out. All right, we've texted over the address, etc. We've also described the appointment a little bit, expectations, what it's going to be like. You've hyped up the doctor, I like to say, or you've sung their praises. So, they know that Dr. So-and-so is friendly and it's going to be great. The spouse has offered to come if it's a big decision. So if this is like a All-on-X campaign or whatever, a lot of times at the appointment, you'll come into the issue of, oh yeah, no, I mean, I'm going to have to talk to my wife about this. This is something. Okay. Well, one way to do that is to actually offer the spouse to come to that appointment so you don't get to that position. 7-day, 3-day, or 1-day call reminders. Okay. So ideally we are scheduling pretty close. So, you may not have to do the 7-day or even the 3-day. If it's like 2 days out, you can just call again the day before or the morning of and kind of call remind, okay? And now the earlier, the better, so that you're not left, holding the bag at like 2 hours before the appointment and you only made an attempt like an hour ago. Okay. So the farther out you can kind of start the call reminders, but not too close to when you actually book them. Like you just booked them and then you call reminded like an hour later. That doesn't make sense, right? So a good cadence of call reminders before the appointment. Okay. And then confirm they're available at that time. Again, I know it might be a bit redundant, but it's just an extra kind of precautionary step. So once you're talking about coming in at 4 p.m. on Thursday, you've confirmed real quick. And just to make sure, no rush. Feel free to check in your calendar even if you need to. But I just wanted to make sure there's kind of no work conflicts and things like that, just to make sure that, since we're setting aside this time, that it's a productive, time for us. There's no work conflicts, no family conflicts, etc. At that time, you'll be free. Just confirming real quick, okay? You can even confirm if they put it into their personal calendar. Now for the close rate, I do want to go into more specifics on this in a future video, but some principles would be that, again, there's a genuine friendly connection, rapport, etc. They just feel connected, right? They feel like they know, like, and trust the office, and it's not like a weird thing where they're kind of like, they don't even feel a good connection with the practice. Very simple. Again, we've turned kind of like price concerns or obstacles or questions or kind of whatever into questions about their situation and just getting a feel for them and how this is really going to help. Okay, getting that and reminding them of the value here, as I say, kind of towards the end. Okay, because if they're kind of just qualifying with these questions and kind of we're just answering interview style, it's better to kind of regain a little bit of control, remind them of the value, like get them talking about how this is a problem for them, right? And how this treatment is what they need, okay? And then going into kind of the next point, case acceptance principles, right? So like, reminding them of the urgency and importance of getting this tooth fixed. Hey, half the tooth is cracked off with a cavity, this is important to get fixed because if we don't address this, the tooth could not be savable, okay? And you may have to pull the tooth, okay? Things like this, just really communicating the urgency and importance of getting it fixed with simple language that the patient can understand, not necessarily dental jargon. And a big point here is the consequences of no treatment. This is a pretty good case acceptance principle just to remember. And then, of course, confidence with your presentation and, again, connection and rapport with the patient. And then if we are booking kind of next steps, if we're doing just a consultation or if they're starting next time, that we can consider taking a deposit of like 10%, 20% or more, or even treatment in full beforehand to make sure that that next appointment is going to happen. This is, again, a financial commitment piece that can really increase that show rate on the next appointment, okay? And if we have a treatment coordinator, that can really help because these folks would be kind of just their role is more discussing the finances and the logistics of getting the treatment taken care of, not necessarily the doctor spending the time to go through, okay, we have this treatment option with this financing amount and this treatment and finances here. A lot of times the doctor wants to do clinical dentistry, right? Diagnose, make the treatment plan, actually do the dentistry, not necessarily talk over the finances and logistics. So that's where a treatment coordinator can really be helpful. Okay. And then financing is going to be big. A lot of times if the obstacle is finances, which that is the majority of the obstacles, financing is going to come up. So that is definitely a good option. So if the financial obstacle is proposed, the price is kind of an issue. What you can then go to is the payment plan. Okay, no problem. Would it be easier if we broke that up into smaller payments over time? You would only have to put down this amount and it would be, this amount per month. Okay. So that's a good way to get over that obstacle. Okay. As I just described here. So guys, I hope that helped as far as actually getting results on the back end for your campaign. It's very important to get a really good contact rate. Once we're getting on the phone, we're having a great lead call. I have other videos on the channel about that. And then once we're booking, it's really important that we maximize that show rate because, again, another issue that you may encounter is that some patients may not be showing up to their appointment. So if you're implementing all of these check marks, you can definitely increase that show rate. And then once they're in the office, making sure that appointment is productive, these points can also help with that. So that being said, guys, again, if you're an agency looking to kind of really optimize your agency and your results, feel free to book a call. If you're a dentist looking to implement a really highly effective campaign for your practice and implement all these and get these results, feel free again to book a call in the link below. And with that being said, I'll see you guys in the next video. Take care.